So hello everyone, today we are here to discuss about the cardiovascular system examination, and before that I again remind you that taking any examination purpose to we have to take the consent from the patient, and again we have taken the consent from the patient regarding the system examination. And in cardiovascular system examination we need a few things, particularly in general examination. And in general examination, what are these things? The first and foremost is the examination of the radial pulse. So you have to stand on the right side of the patient, and then you can ask the patient to just show the hands to you, and then you have to palpate the radial pulse. Babaji, ye haath dena. And in palpation of that radial pulse, you have to take these three fingers and just. So this is the method to palpate the radial pulse. After the radial pulse, we need to know the examination of the JVP, the jugular venous pressure. This comes under the general examination. Examination of JVP. JVP should be examined once patient need to be on the 45-degree of angle, and here we don't have that couch right now, but you have to examine JVP on keeping patient at the 45-degree of angle, and then you have to see the your jugular vein, the internal jugular vein. The internal jugular vein, basically it is passing through the sternocleidomastoid part of the. After the examination of JVP, we have to measure the blood pressure, and after the blood pressure measurement, come to the proper cardiovascular system examination, and for that we need to know about the inspection of the precordium. What is precordium? Precordium is the area overlying the heart. So in examination of precordium, again the inspection, palpation, percussion. So let's start with the inspection. Always expose the patient just above the waist. And inspection of precordium, we have to see again the shape and shape of the chest. So here we can see that the shape of the chest is almost elliptical, the normal shape. In elliptical chest, there is a transverse diameter is more than the AP diameter. Then we have to see any distended veins over the chest area or the precordium. Here you can see that there is a no angos veins or distended vessels. Then just see the position of trachea, because in cardiovascular system also there may be a trachea displaced to one and another side. Then the next is scar mark or any sinuses. We have to look at the precordium or the chest whether there is any scar, because by seeing that, if there the prior sternotomy or there may be a prior wall change, so you may have a surgical scar mark or sinuses may be there. Then the next is the cardiac and the apical impulse. What is cardiac impulse? Cardiac impulse is the visible over the precordial area or at the apex of the heart. Where it is situated, normally the apex impulse we have to see in the fifth intercostal space, just medial to the mid-clavicular line. Ideally patient should be on the lying down position, and you have to see the tangentially, and you have to just at the level of patient, and then you have to see the apex impulse. Any visible routinely, it's not being seen in a obese patients or if there is some other abnormality. Here in this patient I am also not able to see the apical impulse. The next is any other impulses about than the apical impulse. So this completes your inspection of precordium. Next, come to the palpation. In again palpation, start what we have seen in the inspection, then we have to confirm the findings of infection in palpation. For that you have to examine the chest, shape of chest or the size of the chest. For that you need the two cardboards. We have to put them here, and then the AP diameter and the transverse diameter take, and then you will know about the shape of the chest. Then palpation for any tenderness. So we have to palpate whole of the chest from both sides. So you have to just put your hands towards both sides. If there will any pain, patient will tell you. So this is the palpation for any tenderness. Babuji, कोई दर्द तो नहीं हो रहा? So this is how we have to palpate the patient for tenderness. After the tenderness, any direction of distended vessels, because in my patient there is a no distended vein, so we need not to do that direction of flow of vessels. If patient is having any distended veins, then we should do the direction flow vessels. For that you need to do via two fingers. If there is any dilated, generally it's on para-external area, if there is a dilated veins, then you keep your hands and then you put apart these hands, and then we have to uplift the one finger. So if flow is going from above downwards, and if it is not filling that vein, then you have to put the second one. If it now it is filling, then by doing this you can know about the direction of the flow of the vessels. Then third part, the again we have to see the position of trachea. I already told you in my respiratory examination that we have to keep both these index and the little finger and this middle finger to just see the trachea, and this should be done in the sitting position. Now the apex beat, which is a very important part for any cardiovascular system examination, and apex beat is, we have to go from above downwards, because we know that it is situated routinely in the fifth intercostal space just medial to the midclavicular line. And to know about the apex beat, we need four things. One, the location, another one is the extent, third one is the amplitude, and fourth is the duration. So any apex beat should be answered in four location, either medial to the midclavicular line, or it is outward or downward. Then the extent, routinely the apex beat generally in one intercostal space, or in centimeters it is only less than 2.5 centimeters. So if it is if you can feel in only two intercostal areas or more than that, the extent is more. Then amplitude, amplitude means the whether it is a hyperkinetic or it is a hypokinetic. And duration, it is a sustained or ill sustained. So apex beat is in these four terms. Then we have to see the heave. Any para-external heave you have to see on both sides of the sternum, then the para-external heave. And the last one is the thrill. What is thrill? Thrill is the palpable murmur is known as a thrill. And after the palpation, the third one is the percussion. Generally nowadays percussion is not being done in cardiovascular system examination, but yes, we can do percussion. And the percussion is to just know about the your heart borders. So for left heart border and the right heart border, so if you want to do that percussion, then you have to come from lateral to the medial side and just started away from the apex beat where you are. If it is available here, then you have to come from the right side. So for cardiac percussion, we need to know the boundaries of heart, and for that we generally used to do the left heart border and the right heart border. For left heart border, we used to come from lateral to the medial side, and from apex, first you know the apex, where is the apex beat, and then go from the lateral to the, so you have to come from lateral to the medial side. So at the level of apex beat there will be a dullness. Now you can feel that it's a dullness. So by doing that, the proper right and left heart border you may know after the percussion of the cardiovascular system. Last part in the cardiovascular system examination is the auscultation, and which is very important in cardiovascular system examination. Auscultation should be done in all four areas. One is the mitral area, then the tricuspid area, the pulmonary area, and the aortic area. So by ausculting in all areas, mitral, tricuspid, the aortic, and the pulmonary area. So if you heard the normal heart sound, the S1 and S2, and if you may find any abnormal sounds which we used to call as a murmur. These murmur can be in any area, or then if you find any murmur, then you need to know whether it's a radiating to some area or it's non-radiating. If it is in mitral area and if it is radiating to the mid-axillary line, or it radiating towards the upper area or the downwards, then this completes your heart sounds. Routinely what happens, the inspiration, the physiological splitting is occurs. In routinely inspiration there is a A2 comes prior to the P2, but in expiration there is a no physiological splitting. So if there is a splitting, then always it is found in the inspiration. If some murmurs are not proper audible, then you can accentuate the murmurs. How they can be do? Either you can ask the patient to the right lateral position, or you can ask the patient to sit down, or you can ask patient to some other maneuvers which we are doing in the cardiovascular system. So this completes the whole CVS examinations.